everyone, Namaste. Welcome to the program The Healer Nepal. Today we are going to talk about postpartum depression. So people after giving birth to their child have this kind of problem which makes their life very difficult. So we are going to deal on those things. Basically new moms have experiences. New moms has such experience. Birth of a baby can trigger various emotions from excitement and joy to fear and anxiety. So it is normal, but we have to know what are the abnormalities and what are the types, and when we have to be very careful on this. After giving birth to baby, every mother feel various kind of changes, which is physical, also emotional and psychological as well. 50 to 75% new mothers experience such changes, but among them 15% of such new moms develop severe depression after delivery. It begins within first 2 or 3 days after delivery, but however, to some new moms, it can occur within the first year after childbirth. After the birth of child, it can happen within the year also. It depends upon the environment and the psychological strength or economic and financial status of the person, and so on. Postpartum depression is not considered a separate disorder in DSM-5, the Diagnostic and Statistical Manual. It is not regarded as the separate disorder, but rather a type of mood disorder categorized by a major depression. After the birth of a child, a new mom experiences mood swings, crying, anxiety, fear, difficulty sleeping, appetite problem, irritability, sadness. So this kind of changes are normal after having birth because because of the lack of nutrition, because of the lack of sleep, and because of the lack of care, and there are physiological changes. So basically, the symptoms of postpartum depression are the inability to take care of your newborn baby and do your daily activities nicely as you used to do it before. Severe mood swing, excessive crying, changes in appetite, sleep disorders, and excessive crying and crying without no reason, severe anxiety and panic attacks, feeling of hopelessness and restlessness is very dominant after the delivery of baby. Difficulty in making a bond with newborn baby, and sometimes also they tend to feel of harming themselves or sometimes even to the baby. Yeah, we have heard such kind of news in our daily life that a mother has killed her own child. Severe cases they do so, and they might develop the thoughts of suicidal thoughts, and because the new mothers feel that it would be easier for them to end their life instead of looking after the baby and look the positive part of the baby. Postpartum depression occurs due to various causes, which can be physical as well as emotional. Drop in hormones, estrogen and progesterone, and that make human body, women body very vulnerable, so that she might feel, or she is likely to feel frustrated and very restless and very cranky, or in a very low mood, or rapid mood swings, and so on. a nutritional deficiency and very tired because he's very new to care the baby. But this does not mean that it happens to only the first moms. It can happen to the moms who are having babies, having their second babies. So moving forward to emotional causes, they feel very anxious without any reason. Feel very lonely, worthless, and they're very unable to take care of the newborn babies. Self-image is another cause factor for postpartum depression. It is because before the delivery, they used to do work, they used to look very beautiful and attractive. They were engaging in their daily activities as well as in their official works and so on. But after having baby, they could not continue this kind of activities, so that it will make them very it will make them feel very low and doubtful about their own image. It can be the personality as well as the physical body. That is why they start questioning on their sense of identity, because they are limited with the baby and they have to look after them every 24 hours. So it is very difficult for them, and this is the emotional causes factor for postpartum depression. Postpartum depression can be of various types. The first one and the very normal one is baby blues. So women, 75% women have this kind of feelings right after giving birth to the child. A very rapid mood swing can happen, yes. For now you are happy, and after a while you become very sad and you feel very lonely and alone and very sad, and you cry. Such women after giving birth may cry without no reason, because no treatment is needed in this scenario. Only if one enhance the support system to the women who has given birth to the baby, it would make the situation very good. Postpartum depression, on the other hand, it happens after a few months of giving birth to the child. The women feel the baby blues very strongly. We have mentioned which we have mentioned earlier. They tend to feel such baby blues very strongly, and it is very difficult for a women to do their daily activities as well and to function as they used to do it. They used to do their daily activities and households. So it might be physiological causes also. So first of all, such women need to look after visit doctors or gynecologist to check whether it is depression or not. If it is depression, they need medications along with the counseling, so it will help them to come out from that stress. Likewise, postpartum psychosis is another serious mental illness, happened basically after 3 months of giving birth to child. And in these situations, women tend to have kind of hallucinations and delusions. Hallucinations means you see the things, the women see the things which is not happening, and delusion means a very false thought. They are having very false kind of thoughts in their mind, so that they are very irritated, agitated, angry and restlessness. So they need medications. So untreated postpartum depression may last for longer, and it may also go to psychosis, which is a serious mental illness, and it is very life-threatening, followed by abnormal behaviors and thoughts, which is very harmful to the baby also, the woman herself and to the whole family. So postpartum psychosis needs very immediate interventions, and they need a very immediate treatment. You may think it can happen only in women. No, you are wrong. It can happen to the new fathers as well. The new fathers also experience mood swing, irritability, tiredness, frustrated, and various symptoms which we have discussed earlier. And those who have history of depressions, they might experience, they might have a relationship problems in there. You may ask, so these are the symptoms and cause factors and risk factors. So what might be the treatment? So for baby blues, it is very easy. You have to enhance support system to women after having birth. It can be from husband, her family members, her close friends, and others, from anyone. If they get support, it will be okay within a few months. But about postpartum depression, you need women need medications as well as counseling. But on the other hand, in postpartum psychosis, they need strong medications and they need immediate treatment. You should not take a time in that scenario, otherwise the situation will be more worse and very threatening to all the members related to her life. Treatment depends upon the severity of the problems and symptoms. So first of all, you need to visit your doctors and you need to know the severity of the problems. Then you can they will provide you the antidepressant medicines, psychotherapy, counseling, as well as social support, and a kind of group that makes you encouraged and motivated for emotional support. Being a mother is not an easy task. Sure, for that you have to be prepared before, and family members and husband, they have to care for her in these situations and even in the pregnancy, so that her emotional status is very stable and she can handle the situations, or she can cope with the situation positively. Yeah, this kind of things happens. This is very normal. After having baby, you are getting deprived of sleep. You are having sleep problems, nutritional deficiency, hormonal changes, and irritability because of physiology as well as emotional states we have discussed earlier. So family members, they need to focus on these things and they need to take care, instead of saying or blaming her that she cannot handle her one baby. This is her second time. You cannot say so, because this happens to every new mother. You have to be very, very cooperative, family members and husbands and other close people. You have to be very, very cooperative, so that your child and his or her mother gets enough love and care from your family. If you also have such kind of experience of postpartum depression or baby blues, you can share with us in our email. You can send your videos or experience. You can also write email in our email, which is written below in the description box, so that we can communicate and we can share your stories to all of others, and it will help other new moms to get motivated. So this is a very short information about postpartum depression. If you have any queries or if you have any curiosity to ask with us, please write in our email so that we can communicate. Also, if you like to know about some different topics or the topic you want, please email us so that we can manage to make a video on that topic. And yes, I wish everyone to stay safe and keep on watching the Heal in Nepal program, and please provide us comments and feedbacks so that we can make our videos more nice and we can improvise ourselves. Thank you so much.